Of the estimated 28 million people living in Ghana, 842,600 are suffering from severe mental disorder, and a further 2,808,000 are suffering from a moderate to mild mental disorder. Only 2% of people expected to have mental disorder have access to mental health services. Yet, the specialized psychiatric hospitals, which provide majority of the care, are challenged with insufficient government provision and funding. This has resulted in serious cases of mistreatment of people with mental disorder, where many involuntarily have been locked away in the hospitals for decades.
Barely 2% of Ghanaians have access to mental health services, meaning that we have 98% gap. And in the past, the approach for mental health services had been institutional care.
These services were centered along the coast, the three main psychiatric hospitals. So anybody who were having a mental disorder will have to be sent down there for attention to be given him or her. And this brought a whole lot of problems to people and their families, especially those who had serious mental illness, what we call psychosis. Because of the stigma, the family will send them down there and they will never want to receive them back in the communities.
The CHAG approach to addressing mental health needs in Ghana hinges very much on collaboration with the community. But we think that more cases are hidden in the community. And ultimately, the community is the beneficiary of all mental health services. In fact, they are the reason for which we are involved in this mental health service altogether. So the approach is to enlist community architects and players and all stakeholders so that they will be able to support actively the three core objectives of the program that we are implementing at the moment, which comprises: one, improving access to treatment and mental health services being integrated in all child facilities; two, addressing the issue of stigma and discrimination against persons with mental illnesses; and finally, ensuring reintegration of persons who have been treated back into the community so that it will enhance harmonization and integration of the community.
This is Kumbugu, the capital town of Kumbugu district. Kumbugu is in the northern region of Ghana. The district has many communities that are widely dispersed, with a population of approximately 89,000 people. Distance between the district and the southern belt, where the institutions providing psychiatric services are located, is about 650 kilometers.
I've been with KINS for the past couple of months, and we've been coordinating a number of activities within the district with respect to public health programs and reaching out to the communities as well. We also have a mental health program which is aimed at offering treatment to people who suffer from mental health conditions. Our current mental health program is actually structured in such a way that we do not try to institutionalize our patients. We identify them actively within the communities, and those that we identify, we then try to offer treatment to them, either at home or within the facility. The idea is to offer humane treatment to people within their own, the comfort of their homes, where they'll be more comfortable with their family and they receive the care that they need.
What is he saying?
He's saying that there's much improvement.
Okay.
Things that she could not do now, she can do some of them, like setting the fire,
Okay.
sweeping the
the yard.
Okay.
She has started doing some of them now.
The district makes us aware that there are about 363 people within the district who seem to be suffering from one mental illness or the other. In this community, we have several children who are malnourished, and studies have shown that malnutrition has a direct link with mental illness, in that folate deficiency, thiamine deficiency, these are nutritional issues. These are all things that can predispose an individual to mental illness.
CHAG operates in about 177 districts of Ghana, with about 284 member institutions that are directly involved in mental health services provision. So in any CHAG facility to date in Ghana, you'll find mental health services as part of their benefit package to the community and the people we serve.
As a health institution, we contribute to delivering health service to the people of Ghana. And we are a CHAG institution. Yeah, and so we offer a lot of health services to the people. Psychiatry unit is part, yes, and it's something that we've just added on to our large range of services.
The CHAG Secretariat, in conjunction with UKAID, DFID, have had to resource our facilities in terms of training and sponsorship of prescribers or mental health personnel, resourcing or retooling mental health units, and also providing support for community outreach programs. So basically, we are looking at capacity building to enhance mental health services for all our member institutions that are dotted all around, especially in the rural areas, in deprived, neglected, and then marginalized areas of Ghana.
Assessment is by observation. That's the basic. You observe the behavior of your patient, and that gives you a picture of what is wrong with this person.
CHAG has very strong relationship and bond with Kintampo Health Training College. Over the past 3 years, almost 4 years, through the mental health program that we are implementing, we have sponsored and continue to sponsor the training of community mental health workers and mental health professionals all over there.
The center basically was set up to provide services, psychosocial services, to patients, mental ill patients, and to serve as a training ground for our students. So normally we have 3 days of services, Monday to Wednesday, and Thursdays and Fridays are reserved for practical training for our students. On training days, the students are grouped into, say, between 8 and 10 in a group. So they undertake different training aspects of their training. For instance, some of them will go to the communities to experience community care, community entry, home visit, case search. Then others will see how patients are attended to here, psychological aspects. Sometimes in the initial stages, we take the folder, we discuss it with them, look at the history, tease out the psychiatric aspects, the psychological aspect, the social aspect, and how we blend all to provide total care for this patient.
Because then really our yarn Medina changes are fedroom,
Oh, okay. In a day or even a week, can have several episodes of epileptic attacks. Yes, and so they have almost given up in life. But when they will roll on the treatment, some of them now go beyond a month without getting attacks. And there are some that have continuously come for review and have not reported incident of having epileptic attack.
These people, they are the same family with one father. They are all suffering from epilepsy, but they are of different mothers. So they are on medication, Phenobarb, but they are doing well now. But what the mother said, that with this small boy, about 2 months now, there have not been any attack.
My staffs have difficulty reaching some of the communities because of bad road network. The medicines are even an issue. As I sit now, when we have the acute psychiatric disorder that they present so violently, I only rely on Lagator, IV Lagator, to calm the patient down. But as I talk now, I can't boast that it's even available.
Our Caldo, as for Baba, due to shortage of medication, the medication on which he is not readily available to us. So we don't get it for him. That's why he has relapsed. And so we recommend that they give us medication and then a means of transportation, preferably a motorbike for now.
The people in the communities, most of them, they thought at first that mental ill health is caused by demons or other people. And then when they see anybody with that kind of problem, they tend to look down upon the person. Sometimes they mock at the person. And people don't even normally like to associate themselves with the person. But since we start giving them the education that it could be anybody at all who have that mental ill health.
Holy Child Health Center is a place of hope for people recovering from mental illness. The environment helps to develop the physical and spiritual well-being of the visitors. Located in the western region of Ghana, it has become a socializing point for persons living with similar conditions to come and share experiences and also engage in productive economic activities. Joy has come to many who were idling about but are now actively engaged and are focusing on their activities rather than what they were suffering from.
So we want mental health services to be consolidated, sustained and maintained in our system at all times and the rest. And that would mean support, concern, interest, and practical attention from all stakeholders. It means that it is not a project or a program that ought to be left in the hands of one initiator. It must be a national clarion call to ensure that all of us indeed situate mental health services as a priority health service that ought to be integrated, within the main fabric of our health system.